I'm going to talk about the mouth and the throat. So your oral cavity, of course, includes your cheeks and lips for keeping food placed between the teeth for chewing. And then your tongue also allows for manipulation or positioning of the food, and of course sensory input of taste. And then we need to make sure that food doesn't get into our nasal cavity, so we've got the hard palate and soft palate, which form the roof of your oral cavity. The hard palate contains bone, and that would be your maxillary bones and your palatine bones. And the soft palate does not contain bone, but both the hard and soft palate are the roof of your mouth, which separate the nasal and oral cavities. And then your teeth within your oral cavity are accessory organs that do mastication. Mastication means to grind or chew food. And the purpose of mastication, it's a form of mechanical or physical breakdown, and that helps to increase the surface area of all the food particles, which allows enzymes to better attach to your food particles and do chemical digestion. Also in your mouth, of course, you secrete saliva. You have extrinsic salivary glands, including the parotid, the submandibular, and the sublingual glands. You also have intrinsic glands within the walls of the mucosa of your oral cavity. Together, saliva contains mostly water, and water is important to keep food modal through the GI tract, in other words, keep the food moving. Also, we use water as part of our process of chemical digestion, hydrolysis, so it's important that we add a lot of water to the food as we digest it. Another thing you find in saliva is a digestive enzyme called amylase, which starts or initiates the chemical digestion of polysaccharides, specifically starch. If you were patient enough, you could keep some starch in your mouth for a long period of time, and ultimately that starch would begin to taste sweet because you would be using the amylase to break the polysaccharide starch down into monosaccharide sugars. Takes a bit of patience and is a bit gross because you've got something soggy in your mouth for a long period of time. But give it a try with like unsalted cracker. If you can just gum it up in your mouth and keep it in your mouth for a while, ultimately it should taste sweet. All right, another thing, of course, you've got in your saliva is mucus, and you've got mucus all along your entire GI tract. And the job of that mucus is not only to trap pathogens, but also to aid in swallowing. It kind of almost lubricates your food to make it easier to slide that food down into the throat. Also, your saliva does have an antimicrobial property to it. It contains an enzyme called lysozyme, which helps to break down some types of bacteria. Another job of saliva is to act as a pH buffer, so that if you eat something that's highly acidic or perhaps slightly basic, you will buffer that pH solution and bring it back closer to a neutral pH of around 6.8 to 7. So I've already alluded to many of the functions of saliva, but let's be more explicit. Saliva is all about moistening food with water, neutralizing pH using a buffer called bicarbonate. By the way, that same buffer is also in your blood and neutralizes pH in your blood. We begin starch digestion using the enzyme called amylase. In infants and in some adults, we do fat digestion right there in the mouth with an enzyme called lipase. It makes sense that infants would have lipase in their mouth because the primary diet of an infant is going to be fat-based with milk. So infants will start digesting fats from the moment that they get into the oral cavity. Most adults have very limited lipase in their saliva, but some still have lipase in their saliva. I already mentioned that saliva contains lysozyme to kill bacteria, not all types, but some types of bacteria. And another job of your saliva is to bind food together along with mucus into a smush, mashed up substance called bolus. So once you smush up the food and moisten it with mucus and saliva, we call it bolus rather than calling it food. And then another important job of saliva is to cleanse your teeth so that you can avoid tooth decay. I already mentioned there's two types of salivary glands, intrinsic and extrinsic. Intrinsic are located within the wall of your mucosa of the oral cavity. They're the ones that make watery saliva all the time to keep your mouth moist. Extrinsic glands are really only going to be active during the act of eating, and they are extrinsic, meaning outside of the oral cavity, but they're attached to the oral cavity by way of ducts. And those extrinsic glands are a pair called the parotids, a pair called the submandibular, which are underneath your mandible. The parotids are just anterior to your earlobes, and then the sublingual, which are located underneath the tongue. All right, I don't care that you know too many specifics about the mechanism of swallowing. It's a very complicated set of coordinated contractions amongst a lot of muscles, but let's get into just the basics. Swallowing is controlled by part of your brainstem, the medulla and the pons, and there's two major phases to swallowing: the buccal phase, which is voluntary. Buccal basically refers to the cheeks or mouth. And the buccal phase is when you consciously use your tongue to push the bolus, the wad of food, back into your oral pharynx. So you do that consciously using the tongue. And then the rest of swallowing is a involuntary reflex, and it's called the pharyngeal esophageal phase, meaning throat and esophagus phase. And during that part of swallowing, the soft palate has a little dangling structure on it called the uvula, and the uvula will lift up and block your nasopharynx so that you don't get food up in your nasal cavity. The epiglottis of the larynx will fold back and cover up the glottis, and therefore the air passageways into your lungs, so that you don't get food down in your lungs. And then a variety of muscles lining the pharynx, called the pharyngeal constrictor muscles, they're smooth muscles, will push the bolus down into the esophagus itself. Here's an artist illustration indicating first the buccal phase on the left, the voluntary phase, and the involuntary phase on the right.